Hey guys, Don here. Welcome to Podiatry Practice Mastery. We're going over what helps you get the practice to the $1 million mark and beyond. So I feel like I'm getting a little bit more into the groove here with my new medical record. It's getting a little bit better, and specifically, I think one of the main takeaways here is whenever something is out of order or out of organization or takes more mental effort, we put all of our additional energy into that to figure it out versus into being really present and comprehensive with our patients. Because what I was seeing over the last 3 weeks, my numbers have really gone down, and I think it's basically because my Scribe didn't know what he was doing, I didn't really know what I was doing, and I couldn't think outside of the box, or I was too preoccupied about getting my notes done to being really present with patients. And just going back now as morale is getting better, I can be more present and I can offer more things to patients. So I figured out a better way. So within ModMed, there's something called a schedule that you can print out, and it's working a little bit better now as I'm getting better. So I'm going to go over the schedule of kind of patients. This is a recording of a day which is on a Wednesday. Okay. So first patient was left heel plantar fascial pain, number 3 out of 6 shockwave. And then we talked to them also about orthotics. Second patient was, this is a 62-year-old female. We did a lot of things for her. So a lot of these patients, I'm doing multiple things. So she came in, she had bilateral fibromas that were painful. We did a x-ray. Then we did an ultrasound to look at the fibromas. And then she actually worked in the radiotherapy department in the hospital. And so I was talking to her about shockwave, which would help maybe a little bit with the size, but mostly with the pain. But she talked about maybe doing radiotherapy. I'm like, that would be cool to know if they can do that. So she's going to check on that. And then she also had a nail. So I did a nail sample, and I talked to her about that. So we did the nails, we did the fibroma. She had an actual fibromas bilaterally. They were a little bit painful, and we talked about possibly doing orthotics in the future, and I'm going to see her back in 3 weeks to go over the nail sample. Next patient was a 67-year-old female for orthotic follow-up. Then the next one after that, she was doing fine, no 1-year follow-up. Now there was a 39-year-old female for orthotic follow-up, doing better, so just a 1-year follow-up. Next was a 67-year-old patient. He had bilateral neuropathy. He was currently on gabapentin, was already seeing a neurologist, but he also had bilateral posterior tibial tendon dysfunction. And so we talked to him about orthotics, possibly even an AFO, and he was kind of interested in getting rid of some of this neuropathy pain, which is not diabetic. It's more like idiopathic neuropathy. So we'll see what the neurologist says. I'm going to see him back in 1 month, so he had seen the neurologist at that time. And then some of it could be contributing from the feet as well. Next was a patient, a status post. She had some gangrene to the dip of the left toe. She had seen multiple doctors. They didn't really think it was gangrene or diagnose that. I diagnosed it as a circulatory issue. She's 83, and she got a revascularization, some stenting, and now her toe is feeling much better. She had a little callus to the tip, but I'm not touching it. Just let it fall off on its own. Next was a patient, plantar fascia patient, number 3 out of 6 for shockwave, has a few more sessions. Next was a patient, status post, 6 weeks after the 6 sessions of shockwave, and he's 100% better, so no need for follow-up. I think I just put him in for a 1-year follow-up due to his orthotics. Next was this was a 13-year-old patient that this is visit number 2 for Cantharidin. So she's doing Cantharidin versus Swift, but Cantharidin visit number 2. They're going to come back in a month. 2 to 4 weeks for the Cantharidin treatment. Next was a 37-year-old that had ultrasound, and she was 6 weeks after her last 6 shockwave treatments. She was feeling better, still a little bit of pain, so I did shockwave number 7 and ultrasound number 2, and I'm going to see her back in another 3 months. So usually after I do 6 shockwaves, I do a 6-week follow-up, and then if they're doing well, I'll double that, so I'll do a 12-week follow-up, and then I'm possibly do another shockwave at that time. So the one benefit to ModMed, in my opinion, is these ultrasounds are getting more captured. Whether I'm going to get paid for them or not, I'm not sure, but it's capturing more. Like when I do bilateral ultrasounds, it's putting 2 reads in there. If I'm doing multiple toenails for ingrown toenails, it's documenting those, where I think a lot of times they were lost in the past. Next was my MVP patient of the day. So this patient was a patient that had been getting my newsletter for 10 years, okay, and they'd finally decided to come in. So this shows the importance of longevity of having a newsletter. 10-year, so I send out a weekly newsletter, and I add about 100 to 120 people to my email list each month. And those are from people logging into the website and downloading free things. And then it just kind of adds up. And so this patient came in, had second med head pain bilaterally, and had watched a lot of my stuff, got x-rays first, didn't really show much, got ultrasounds that showed some effusion at the insertion of the plantar plate. At the plantar plate there. No tear, some thickening of the tissue. And so we're going to do bilateral shockwave, 6 sessions, and then most likely orthotics at the 3rd session. So this one is going to be the MVP. So basically that's going to be about $3,000, so $1,500 each foot, and then possibly the cortisone as well. The orthotics as well. So that was one, like, if I didn't have all the goodwill over the last 10 years, it wouldn't have been, not saying that easy, but they already know what to expect. And I had a similar patient, I might as well talk about it now. This was a patient that came in, he had watched all of my stuff on plantar fasciitis, meaning he probably downloaded our newsletter or my plantar fasciitis course that I have, went through it all, knew what to expect. He knew I was going to get x-rays, knew I was going to get an ultrasound, knew what to look at. He knew what the pictures were in my actual presentation. And so he's going to schedule for 6 sessions of shockwave. And so that is like an ideal patient. So patients that come in, they've already watched the stuff on the condition. Those are really the ideal patients for my practice. Next was a foreign body removal in a 41-year-old female, so we removed that. Next one was this is an Onifix patient. She had one on the left done. She already had one previously done on the right side. Next patient was a 78-year-old female that had bilateral hallux cariflex. Now this is one that she came in to see one of my partners because of an ad that we put in the newspaper about having like a toenail restoration. The challenge was she signed the consent, but she didn't pay attention to the price. And then when I got in there, she was like, oh, I didn't know it was going to be that much, because she was asking ChatGPT the price of cariflex, which is like $45. And so I had to tell her, sorry, it's $125 for the first nail, $50 for the second, so it was $175 plus $75 for the kit, so that's $250 to do 2 nails. I think she was pleased with it, but a lot of it is expectations for patients. Next was a patient that came in after a number of years, had a large bunion, got x-rays. They're going to need a Lapidus, so I referred them to one of my colleagues for a Lapidus bunionectomy. Next was a patient that got orthotics. She was a 63-year-old. She had painful bunions, and she had already tried anatomic shoes, so now we're going to do orthotics for her. Next was a 68-year-old man that has nail fungus. We reviewed the pathology, got LFTs, and put him on the terbinafine with a fungus kit that he's going to get today. Next was this is that 63-year-old that I told you that had been following me online for plantar fasciitis, and he got 6 sessions of shockwave with the X-ray and ultrasound. Next was this is a 54-year-old female that did shockwave number 5 out of 6 for her painful os peroneum, and it's getting better. Usually by session 5, people are feeling better. So one of the benefits of doing like 5 or 6 is that you start to get better by the time they see you at session 5. I guess another option would be do them every 2 weeks. Next patient was this was a hard one. This was a 93-year-old female that has some gapping between the first metacuneiform joint plantarly, and it's painful, and it's kind of got some prominences there. And she asked me, so doc, she's 93, she says, so doc, I don't want to ask my kids for money, but if these orthotics don't work, are you going to refund my money? I've never been asked that, but I was like, at 93, that's fine. I'll refund you minus the expense of the orthotics if they don't work. But I think sometimes going into it, like knowing patients can get a refund, it makes them try a little bit less hard. I tend to not include that up front. I'll tend to say that if it doesn't work, then I do that. And this last one, the next one, was a 63-year-old female. She came an hour and a half all the way from New Hampshire because she found us online, and she was seen by another doctor that recommended forefoot surgery. She had really prominent metatarsal heads, pretty much all the metatarsal heads. The worst one was on the 5th met head bilaterally. So what I did for that, and what I usually do for that, in the shoe liner she had, I actually cut out that and moved the proximal, so almost like doing a pad proximal to the 5th met head. And I did that in her shoe. Then I also scanned her for orthotics. And so in this specific case, because she came from an hour and a half, I'm going to have her the orthotics sent to her. So we charge 50 extra to send them, and then she'll do a 6-week follow-up. She's a veterinarian, but she came this far to see us, which is kind of a nice compliment. And then the next patient was a 25-year-old man who had an ingrown toenail. So we did an IND for him. And then I guess there was one other patient that had bilateral cariflex. So a lot of cariflex. I would love to give more of those to Marjorie, but I did do 3 orthotics. And, as I was looking at numbers, I think the key for me anyway is I try to put the number of orthotics I want each day, and it keeps my mind on the prize. So if the goal is to produce $4,000 per day, that's the way you get to the $1 million mark. If you do 2 orthotics, that's like $1,200. Like you're like a fourth of the way there if you do 2 pairs of orthotics. So I think that really lowers the bar of how much you need to produce with patients in each visit. So that's kind of what we were kind of working on. If you have other things that are working well for you, let me know. And I hope you guys find this beneficial. It's getting back to a little bit normal. I'm not going to be complaining as much about my medical record, and I'm able to focus more on these high level checks.